Hello, everyone. I think, it feels like an empty room, but I'm going to go ahead and get us started because we've got to stay on time. And, everyone here has worked really hard to get their presentations down to 7 minutes or, whatever, so every minute counts. So welcome. Welcome to everyone in the room. Welcome to everyone who's joining us online. I see 11 participants joining. My name is Andrew Armstrong. I'm the Global Lead for Data Integrity at Uptime Global. You'll hear more about what Uptime does in a little bit. I'm joined online by colleagues from the University of Oxford who have contributed greatly to the content of what we'll be talking about today, as well as we'll be joined shortly by someone from WHO who has also contributed to this session. And then I've got folks in the room who are co-convening, so people from Global Water Center, Heidi and Tess, if you would raise your hand, and they'll introduce themselves to you later. We've got people from Cova, Aaron and Wes and Ryan, as well as people from Ugandan Water Project, Tanner. All right, great. So you'll hear from all of us as we go along. Make sure my slide advances here. There we go. So we are framing this session in the context of a results-based funding approach that Uptime and colleagues at Oxford have been developing over many years. Specifically, since this is the Water and Health Conference, we will be focusing on the water safety aspects of it, but this is a comprehensive approach that we apply. Really recognizing that water safety is one of the most critical factors that affects people's access to safe drinking water. When you take all the different facets of safely managed services, water quality and water safety is probably the most critical aspect that's been unaddressed historically. So what this approach that we will be talking about really draws on some core principles from the WHO Small Water System Guidelines, specifically implementing water safety approaches, incentivizing progressive improvement in water safety management, as well as providing actionable information to relevant stakeholders. And so how we have modeled that in our results-based contracts is Uptime delivers payments to service providers based on this framework that you see in this diagram here, whether or not services are reliable and protected as a threshold for payment, and then payments are calculated on indicators around volume and water quality and revenue. This approach, or this session actually, is the third of a series of sessions that we've had over years at UNC. So just to kind of walk you back to the progression, 2 years ago, we talked about this approach. We kind of got feedback from everyone who was in the room, all you smart people, and we took that and applied it. Last year, we reported back on some piloting of this approach over the last year, and then we really kind of dug into the WHO guidelines since they were out last year and thinking about how this applies that approach. This year, rather than doing the same thing again, we felt like it would be helpful for us to dig into the data systems that underpin this approach. So specifically today, we're going to be showcasing tools and verification protocols, and even all the supporting infrastructure that goes around the data that goes into a results-based funding approach. And with the other aspect that everything you're hearing today is building into national models, and in our case, national results-based models that are managed managed by government and implemented at a national scale. A bit more about Uptime. For the last several years, we have been applying this results-based approach, which you'll hear. I'll tell you a bit more about that in a couple of slides. With several service providers. To date, we've worked with 15 service providers in 16 countries. In 2025, these contracts are covering about 110,000 water points. And the key there is that those water points have greater than 96% of the time they are functional. So they're allowed 3 days of downtime in a quarter. Users are paying, so people are paying for this service. This year, $2.6 million is what we're projecting that people in rural areas are paying for these services, but not covering all the costs. So service providers are being subsidized to continue delivering these services, and they're serving about 4.8 million people this year is what we project. So we have a couple of other service providers in the room that I didn't mention earlier, so maybe Water for Good, you want to wave your hands? Safe Water Network is here, also if you want to wave your hand. I don't see anyone else, other service providers, but Uduma is in the conference too. So we've got several service providers who are under these kinds of contracts, and I encourage you to talk to them if you have questions about how this applies. If you can't grab me. Increasingly, what we are doing is taking these principles that we're learning from these contracts and applying them, as I mentioned, in country-based national models. So the 3 countries where we have the most traction is in India, specifically in the state of Karnataka, which is practically a country in itself, as well as in Bangladesh and Zambia. All of these models all have the same principle that results are being delivered and verified results are being delivered, and then payments are being issued. The way that Uptime is working in all 3 of these different countries is different. I don't have time to go into all those details, but I do want to highlight as a big model and a big milestone that we've achieved in the last several months is that the government of Bangladesh is putting money into this. So half of the funding that goes into a results-based contract, let me re-say that, half of the subsidy that's provided is coming from the government of Bangladesh, half of the subsidy is coming from Uptime for professional service delivery to be applied in Bangladesh. And the vision for all of these models is scale at a national level. So the purpose of this session really is the data integrity behind those systems, which I nerd out about. I'm very interested in how do we trust the data that's delivering or provided to deliver these services. So if you don't have trust in the data that is reporting on services, or if the services themselves aren't delivered, this whole model falls apart. Okay, so we have been carefully tweaking systems to validate and verify the data that's reported to us on these contracts over several years. We wrote this up in a paper that you can look at on our website, and I encourage you to go read about it. It digs more into the kind of processes that we apply. Really, the idea behind this is this applies in a results-based approach, but better data, better information systems is applicable even if there's not a results-based contract in place. And better data generates what we call a data dividend for governments and development banks and corporates. And really, the key here is that we say funders a lot, but what we're trying to do is treat government as a funder and influence government funding, public funds for results-based contracts. So last slide here from my side is a bit about how our framework works. So this is how our contracts function. And I want to highlight a few of the things, interpret a few of the things that you'll be hearing about from some of the other presenters this morning. The fundamental piece of a results-based contract and any service delivery model is, in fact, the service provider, okay? You might actually say the user's valuing the service is important. They don't show up in this diagram, but the service provider, so every group that we work with, they could be social private enterprises or NGOs, but they have some core characteristics in common, and that's that they have the legal authority to operate in the area where they're working. They have quality data systems that underpin the contract, and so they're able to report. And you'll hear about some of the service providers that have their data systems that they put in place. And they deliver services that add value to people. So those service providers have a contract with a separate entity that's a results-based funder. In our case, often it's the Uptime Catalyst Facilities, a separate funding agency. It could also be governments, could also be corporates. That contract, under that contract, the service provider is required to report results to an independent verifier, which is Uptime, which is where I sit. So the performance is reported on a quarterly basis, and then we go through several processes of validating, and we do field visits to make sure that things that are reported to us are actually happening on the ground, and then we do a global comprehensive data audit. We then work through any issues with the service provider and then confirm results to the funder, who issues payments or issues sanctions as appropriate. So you'll be hearing about some of the different elements of this data system from some of the folks that will be presenting. And especially a big thing too is that professional service providers don't just like magically happen. They invest in building their own capacity, and so that's a big piece of what we'll be talking about today. So the rest of the session is going to be kind of follow this order. You've heard from me introducing this and framing it. You'll hear from Global Water Center talking about maybe some of the more systemic work that they're doing with WHO to enhance sanitary inspections across the world. But then we'll kind of narrow down into two case studies. We'll hear from Ugandan Water Project on some work that they're doing with the government of Uganda to improve data systems, really, under the philosophy of a results-based approach. And you'll hear from Cova and the work that they're doing in Honduras. And then the last third of the session, we'll break up into groups, and we'll talk about some of the things that you're hearing, and hear some concluding remarks from WHO, as well as folks in the Ministry of Water and Environment in Uganda, and some funders as well, or a funder. So with that, I'm going to hand the floor over to Tess and Heidi from Global Water Center.
Thanks, Andy.
Hi everybody, my name is Tess Brody and I am with the Global Water Center as our Technical Services Program Manager.
And I'm Heidi Fuller, also with Global Water Center. I'm the Director of Training. Who's also mentioned on here is Rory. Is Rory one of the ones that's online with us?
Not sure.
Not sure. Okay. So Rory is with the WHO, and actually Tess and I are working with him on two separate projects that we're going to feature here today. And so he's championed and really taken the charge on both of these aspects that we're going to present on, and helped us put this together for you. So one of the key things that I've learned, one of the projects that I'm working on is, and what Andrew has mentioned, is the basis of the WHO guidelines. So from the drinking water quality guidelines, the core recommendation actually fits into this data system. So you have health-based results that lead into the water safety planning and then into surveillance. So you've got in the water safety planning, the management level, risk-based management, and then the surveillance is more that regulation verification aspect. And from the WHO, that's what they're promoting as a core guideline for safe drinking water. What they did with that from the main guideline was they took it and framed it around small water supplies, and really tailored guidance within this guideline to support what Andrew was saying is that progressive improvement. So this is forming the basis of the work that we're doing on the sanitary inspection piece. So a key part that Rory actually worked on was the upgrade and improvement of the sanitary inspection packages, I think between 2019 and 2023, and he was a key spearhead in that project, so he comes with lots of experience. The SIs are a simple on-site evaluation tool that can be used at two levels of that core guideline, the core recommendation. There's from that guideline, there's the 6, and it's going from the promoting and supporting water safety planning, and SIs can also be used at the risk-based surveillance stream. And I think what I'm seeing as I'm learning more about this and how they're applied is that they're used by two different entities, but then it's part of that data system that Andrew's talking about that we're trying to build out. And so the WHO is really promoting these for application. And when I speak with Rory and Angela, who was the other WHO representative, it was more that the water safety planning, particularly in smaller rural systems, can be just too large to take on. So they're really trying to promote the use of the sanitary inspection as an entry point and a progressive improvement from doing nothing because it's too complicated. And so how can they bring that into the small rural supply systems? But then also a big, WHO is really advocating for the integration into national accountability measures, into their structures. So at that fifth level of the risk-based surveillance. So what I hear from Andrew when he's presenting here is like, Uptime is providing that surveillance and verification as an independent, but really trying to promote it at a national level to get scale. So how Rory's, when I'm speaking with him and we're building a course together, is trying to look at how do we get it more broadly used, more consistently used. But one thing that I have heard from some implementers, something they really appreciate, is that the sanitary inspections are adaptable to context. And that's what we've seen now in Indonesia is one example where it is being integrated into Ministry of Health as a surveillance mechanism, something that they can implement at a national scale, but they've actually adapted it to their national context. And Tess is going to show you a little bit more about how, a little bit more into the sanitary inspection packages and how they're set up for that adaptation. Ghana is another example that Rory wanted to feature of another government level. They're doing an audit on their WSPs, but how can they do it simply to try and integrate their results into that, and the SIs are being piloted at the moment. And one of the key factors that they're looking for is supports on how to actually integrate the sanitary inspections in their practices. I'm going to hand it over to Tess.
So as you all know, it's important that we're listening to what's happening in the field, and the WHO has heard some of this feedback, and these might be common things that you guys are also hearing, but things like we thought that anyone could pick up the SI package and just use them. But it's clear that ongoing capacity building is needed for effective and sustainable uptake. Another comment is that paper forms are useful as a starting point, but we need to make use of technology to better streamline data collection and drive prompt and meaningful action. And then this final comment is that we find that risk perception is subjective. How deep does a crack in an apron need to be to represent a risk? How can we help ensure more consistent scoring? So in order to help with this uptake and actually make these tools useful, there's kind of two areas of work that we're going to talk about. First is the digitization of the WHO SI forms into mWater. The goal with this is to actually make these tools really usable. And so with the WHO and Global Water Center, we've been working together to translate the versions that exist of the SIs, which are existing in both PDF forms and Word document forms, to allow for that adaptability and that contextualization. We're taking those in and putting them onto mWater so that they can be easily accessed and used and implemented in your organizations. And so this work we've been able to move these forms into development, where we can see you can have automatic scoring happening once you're filling out your form. You can have the illustrations actually showing up on your mobile device to help in the process of an inspection. And there's also additional prompts that can be accessed right there during the survey to provide additional instructions and clarifications on what those risks look like. And these things will all help improve that standardization of what are the risks that are being identified, and how does a enumerator who's in the field make those decisions. So this is a great starting point for accessing these tools. Another thing that we're really excited about is that we've been working together with WHO and with mWater to create a global indicator on the mWater platform. And what these global indicators do is they allow us to connect the data that organizations are using across countries, across organizations, and connect that data together with this global indicator platform. And so hopefully soon in the next couple of weeks, we'll actually see this global indicator page go live on mWater, and that will allow you to access all of the forms and as well as to connect this indicator to your existing work on mWater, or to start a brand new form yourself. So our hope is that on by putting the SIs onto M-Water, we'll see data being streamlined through the collection process, through the reporting process, and to help enable decision making. So we really want this to be a helpful tool to the sector.
Okay.
Yes. So for those who are not familiar, M-Water is a mobile data collection tool that allows people in the field to collect data on various subject matters. So M-Water is a private company, but they have services that are available for free, as well as the ability to pay for customizations depending on what your needs are as an implementer. So mobile data collection is really trying to move away from paper-based reporting and into digitizing the results that we're seeing to help improve things like data validation and to improve the quality of data that is being collected. So big shout out to M-Water. They are represented here at the conference, unfortunately, also hosting at another session right now. So if you're interested or have questions about M-Water, please come ask me. I'd be happy to make a connection for you. Thank you for that. So next, I'm going to hand it to Heidi quickly to talk about the other resource that we want to offer the sector, which is a new training course that Global Water Center is developing around risk-based water quality management and monitoring.
Great intro. So under development at the moment, in process is an online training program really focused in on this risk-based approach to management and monitoring. So the core areas that we're looking at, and this is in collaboration with the WHO, so Rory is one of our key subject matter experts working on the program, and also in collaboration with a number of partner organizations that are acting as advisory. So like Cova, Uptime, Oxford, one of the, Saskia and Jennifer, I think, from Oxford, and also Akoya, to just get that real integration of like what's working, what's not working. We really work from at Global Water Center a space of like, what's the problem? And we build backwards from there. So we start with what results are we looking for? What problem are we trying to solve? And then we design in a backwards way from there, really integrating on the ground experience, trying to integrate scenarios into the process. So the course structure at the moment is looking at, so an intro into the risk-based approach from a WHO perspective, planning and conducting sanitary inspections. This was key feedback from the WHO, that they get so many questions fielded about how to implement the programming. But another key factor is planning and conducting water quality assessments, and then how do you bring those together? So that's the first 3 units. The next 2 units in the course is one, data interpretation analysis from a complementary perspective, but also then the last one is data into action. So really looking at how organizations are able to take that data and use it for corrective action or improvement. So it's under development currently. We're going to pilot it in January, February with just a smaller cohort group, and then it's going to be open for delivery April, May next year. So I invite you to follow along to see as that rolls out. So supporting publications or access that we've mentioned in this presentation, your guidelines and the sanitary inspection packages, the M-Water form, and then new courses scheduled for Global Water Center.
Thank you.
Thank you. We got it in time. Oh yeah. We'll leave it up there for a second while we hand it over to Tanner's next from Uganda Water Project.
All right. Hey everyone, my name is Tanner Hoffman. I'm the Director of Program and Operations for the Ugandan Water Project. Today I'm here to talk about a program that we've been supporting with the Ministry of Water and Environment called RUMIS. So I do want to acknowledge the ministry is represented here. We have Assistant Commissioner Engineer Ivan Burunji in the room. He'll be able to give some closing remarks on this session. But I'll be talking through RUMIS and some of the features and how it ties into kind of the through line of this presentation, which is data you can trust. So what is RUMUS? RUMUS, it's a national data system for water infrastructure in Uganda. It's been built for the MWE, the Ministry of Water and Environment. It's been built under their leadership. And kind of the intent is to digitize some of the front-end data collection and to help improve some of the management capabilities for that data specifically. And ultimately to integrate and feed into other ministry databases for water infrastructure in Uganda. So there was an MOU signed for RUMUS earlier this year that kind of sets the stage for global scaling or for national scaling in Uganda. But as of right now, there have been 23 districts where RUMUS has been onboarded in Uganda. Those are the colored dots you see on the map. And there's another 5 or so currently in process. Just want to kind of touch briefly on kind of the key players who have been involved in this to date. Of course, the Ministry of Water and Environment providing overall leadership, strategic direction, guidance, etc. The Ugandan Water Project, who I'm representing, we've been playing an on-the-ground coordinating role and providing training and support to the local district governments who are ultimately using this system. And then our friends at MWater, the RUMUS platform is built on MWater. Thanks Tess for giving the introduction to MWater, but RUMUS is built on MWater, which means it has all the benefits and all the wonderful features that come with MWater and what it's able to do. I do also want to acknowledge briefly that this has been a big tent for involvement so far. A lot of different organizations have contributed, and in a lot of different ways as well. Some organizations have supported platform development. Some have supported and funded district rollouts. And others have contributed by sharing their data and contributing to the platform that way. So there's not enough time to go into all these players, but I do want to acknowledge the contributions of others. And just recognize that this is a big tent. We are eager to find more and more ways for different partners to become involved and to support the district rollouts throughout the country. So RUMUS, so I know I mentioned it's a digital data platform for water infrastructure, but I want to go a little bit more in detail on that, just get into what's behind the scenes here. So as I mentioned, it's an MWater based MIS. So it's actually a custom configuration of the MWater app and the portal. And it's being used for digital data collection using the standard Ministry of Water and Environment forms. And basically is set up to follow their standard processes for data collection. Also, there's the benefits for management and analysis that come with the platform, data cleaning, visualizations, reporting, etc. And we've just done a build out to get some new KPIs built into RUMUS. So these are, I say new KPIs, they're not new to the ministry. These are the ministry's KPIs and the key things that they're trying to track and stay on top of. But we've just done a build out to get those KPIs into MWaters to make the reporting, the analysis, etc. easier. So that's all built into the RUMUS portal itself. And then one feature that I do want to highlight that's unique with RUMUS is even though it's a government platform and it's owned and directed by the ministry, there is the ability for partner organizations such as us, the Ugandan Water Project, to share data directly with the ministry. So the idea here is it helps to break down some of the data silos that exist. So any organizations in Uganda that are using MWater can opt their data in. They can share their water points, they can share their survey data, and they can get that to the ministry if they're interested in sharing in that way. And I think one specific use case that ties back to Uptime and the Uptime Water Quality Incentive in particular is how this can be used for reporting back to the government on water quality results or sanitary risk inspection results. So this is a use case that we have with our operation and maintenance program, AquaTrust, which is Uptime funded. We're collecting our sanitary risk inspection data, we're doing our water quality tests, and we're actually sharing that data directly with the district local government via RUMUS. So this district in particular has gone through the RUMUS process, their staff have been trained, and they're able to access this directly, which really streamlines that reporting and communication process. But with that as context and background on RUMUS, I do want to anchor us back to kind of the through line of this whole session, which is the data that you can trust, verified results in rural drinking water services. So when it comes to us and our role specifically as it relates to RUMUS, the way that we're trying to get to that outcome of improved high quality data, verified data, our approach is really through a heavy capacity building effort. So there's nothing revolutionary here. It's not a surprise that building capacity and delivering trainings is a way to get to that data you can trust, but that's really been our approach in the role that the ministry has asked us to play in the process. So we've been, as part of that process, delivering trainings for the local government in particular. So it's usually anchored to the district government, but there's a lot of state or a lot of sub-county government officials that are tied into that training process, other NGOs or stakeholders in the field. But there's a phase of enumerator training where they're getting trained on how to do data collection for point sources and water systems. Also data manager training, where the data managers, usually the district officials, are learning how to do the data cleaning, the analysis, and the reporting using that RUMUS system. And then there's actually, in the onboarding process, a data validation stage where our team is out there, typically with the government representatives from the district, from the ministry, kind of verifying the results, confirming that everything was done accurately and to the standards that the ministry expects. And we participate in that process with them in the districts that we are onboarding to help make sure that's there. And there's also the dissemination process where different stakeholders are brought together, that the data that's been collected, their findings are shared, and we start to build momentum for this to really be a process by which data continues to be collected and updated by those local government stakeholders on an ongoing basis. And we do try to stay involved on that ongoing basis through ongoing coaching, help desk support, so that if there are challenges that develop over time, we are still there, a phone call away, to provide the support needed to make sure that the lessons learned stay ingrained and institutionalized with those government stakeholders. And at the end of the day, what it really is about for us is helping to support and build capacity for a sustainable process, where the ongoing data collection requirements of the Ministry of Water and Environment can be fulfilled through the RUMUS platform. It's not a one-off mapping activity or a one-off project. We really see this as an ongoing process, and we're there to support in that role so that it does become ingrained in the ministry's standard processes. And at the end of the day, we're trying to help support people like Mohammed here that's left this quote with, he's responsible for data collection in his district. And we want to support him and his ability to do that job, as directed by the Ministry of Water and Environment. So, RUMUS.ug is public facing. It is available if anyone wants to go and take a look. Not all the data, not all the features are fully public facing. Some of it is limited by permission levels, but anyone can go to the website and see what data is public facing. So with that, I'll hand it over to
Awesome. All right. I think that's low enough and everybody can hear me online and in this room. It's a pleasure to be with you and to continue a few themes that we've heard. Initially, capacity building, working with government, working within the systems we work. And before I dive into talking about government reporting, I'd like to introduce you to Cova so that you can better understand our experience and lessons learned. We're a nonprofit social enterprise that supports rural water system operators. So in this case, we're not the direct operator, rather we are supporting them in their mandate to provide safe water services. Our operations began in 2008 in Nicaragua and expanded to Honduras in 2018 and more recently to El Salvador in 2022. And our approach is community-centered and data-driven, and it's always been focused on water quality. So prior to our engagement with service operators, only 15% of communities have safe drinking water on average. And through our circuit rider model, Cova has ensured safe drinking water to over 1.7 million people across over 2,600 communities. Now, how do we do this? Our circuit riders. They install locally made and affordable passive inline chlorinators to existing water systems. They ensure safe water service delivery by providing capacity building for effective operations and management, system technical assistance, chlorine distribution, and routine water quality monitoring services. And we use M-Water, so thank you very much, Tess, for introducing us all to M-Water, to document all of our activities and water system related data. And the water systems that we support either are gravity fed by springs or pump systems fed by a borehole. These systems have gravity fed water distribution networks and on-site collections to either households, clinics, or schools. And they range in size from a few hundred connections to 1,000. And what we really want to highlight here, similar to what Tanner was saying, is that partnership is key. And close collaboration with local government is central to our work and always has been. We work in direct partnership with the rural water system operators, like I mentioned, and these are the community water boards and committees. For context, these community water boards are the legally appointed entities responsible for providing this service, and they're elected volunteers. Elections take place every couple of years, and often members are from humble backgrounds. They're not professionally trained water service providers. Cova also coordinates with the municipal regulators, officials from the Ministry of Health and the water and sanitation units, facilitating water quality analyses, sharing data, and supporting their mandates. We have a long history of sharing water safety related data with these government entities. And it's been interesting to see how that has changed as we have piloted with Uptime additional water safety assessments. And so with that, I'd like to explain a little bit about where Cova has gone with Uptime. So our contract grew from just reliability in 2023 to include water safety assessments in July 2024 with Honduras, and then recently expanded this year to include Nicaragua. And through our partnership with Uptime, we've generated more water safety related data. And while we now have results-based funding for complete water safety assessments in Honduras and Nicaragua, we are currently receiving results-based funding for just the sanitary inspections. And right off the bat, and as I kind of alluded to initially, the partnering with government is key prior to thinking about reporting. And so since the requirements for Uptime water safety incentive don't align perfectly with the current government regulations, this community and local authority buy-in was key from the onset. And while this isn't an issue with a sanitary inspection so much, people in government and entities were excited to take this on, and it was a challenge with the E. coli assessments. Government regulations require biannual assessment, and the Uptime water safety incentive required quarterly assessment. What are you going to do with that data? How much is it going to cost? And so while Cova offers at-cost water quality analyses and additional discounts to incentivize this additional E. coli testing, water boards are responsible for paying for them in the end. And as such, it's important to dialogue the benefits of increased sampling with the community water boards and the municipal authorities. And in our experience, these dialogues can take a few months, or they can take over a year. Now I'd like to dive into a little bit more about how we're reporting, starting with the sanitary inspections. Cova conducts them with the water board in person, obviously completing a digital survey in the field using M-Water. And all the data go through our internal quality control process at both the country and global levels. Cova also provides in the moment a summary of the inspection at the time of visit in paper form to the water boards. And at a later date, they are also provided with a paper copy of the raw data extracted from M-Water. Subsequently, municipal authorities are also informed. This isn't our responsibility per se, it's really the water board's responsibility to do so, but Cova likes to share these data with the municipal authorities. And in Honduras, Cova submits this raw data extracted from M-Water monthly in a PDF format via email. Municipal regulatory authorities, including those at mancomunidades, which are associations of groups of communities, these entities receive this information and then submit them into the national data systems, which this information is then shared with CSR, our regional platform. In Nicaragua, the situation is a little bit different. These data are more informally provided to municipal regulatory authorities, typically as Excel extracts from mWater and as physical copies. Since a new norm for water safety planning was passed just this year, there's more and more interest in the results of the sanitary inspections, and we've been sharing more and more data. Now, oops, sorry for that. All right, so now I'd like to focus just on Honduras, where we're doing the full, here, the full E. coli and chemical assessments. And here in Honduras, we analyze the coli and the chemical analytes in our laboratories, which are government certified. And the data are entered into mWater and go through internal quality control processes. We follow the same data reporting process as previously explained with the sanitary inspections with respect to delivering paper results to water boards and monthly electronic submissions to municipal authorities. Thankfully, to date, we've had limited arsenic detection and fluoride has never exceeded limits. Nevertheless, the communication of these results is done in a timely manner and accompanied by a visit within a week to explain the results. And when a positive E. coli test is received, Cova communicates them verbally or by text message to the community water board within 48 hours. Cova works with the water board executing technical assistance visits to identify the root cause of contamination and works to resolve it as quickly as possible. We use free chlorine residual tests during these visits to try to troubleshoot and understand what's going on, and E. coli testing is repeated once the root cause of contamination seems to be resolved. As a result of the increased water safety data this past year, our teams in Nicaragua and Honduras have noted not just improved relationships with the local government and communities, but also improvements in safe water service delivery. And as with any process, we're mindful that the way in which we share data could be improved, but we look forward to doing so in partnership with local operators and authorities. So thank you. I think that was under the 2-minute mark.
Perfect. Excellent. Thanks to all the presenters. I want to do something here. So we are now quickly moving into the interactive part of this session. I've had you sit for 45 minutes right after lunch, and hopefully you process some of that. But what I'd like to do is maybe connect some dots for you, because a lot of you are probably thinking, I came to a data session and I just heard about a lot of stuff, which is interesting, but some of it was data or whatever. I just maybe wanted to talk through. So we heard from Global Water Center about sanitary inspections, which are themselves an information source on sanitary health hazards that can be applied efficiently and effectively at scale. And what Global Water Center talked about were some really practical ways that they are working to improve the quality of information that's collected in sanitary inspections through digital form and mWater. And then a training program that they're putting together that can be used to standardize the way that information is collected via sanitary inspections. Then we heard from a couple of service providers that are really two of great examples from within Uptime's partner network that have really sound data systems, and how they are building those data systems into national information systems. Okay, both of them are using mWater, so that's a commonality that we've heard across all these presentations. Digital data collection is an important thing, but with what Tanner shared, really the work which is behind RUMIS, the effect, the impact that RUMIS in Uganda is having is really because Ugandan Water Project and other partners have put so much effort into training their own staff and training other partners in how to use this, and just training and capacity building for good quality data is we can't speak highly about the importance of that, too high about the importance of that. Something I want to highlight from what Aaron said was just the relationships with communities and governments. And if you're going to trust data, and if you want people to use data, they're not going to trust it unless they know who you are, and unless you know how to deliver that information to them in appropriate ways. And so Cova even mentioned in Honduras and Nicaragua ways that they've adapted their information sharing approach with government so that in those different contexts, government will actually use it. So I just rambled through a bunch of things, but trying to connect dots for you why these presentations, how they all kind of relate to data. And the hope is that some of the things you heard will lead to ideas that you have in your own areas of work or things that you can apply. So we're gonna do a little Mentimeter exercise just to give you some time to process this, what you just heard. Some of you may already have this up. If not, you can use a QR code. If you don't know how to use a QR code, there is a little tiny link there you could probably type in to your phone. But I invite you to pull that up, and we're gonna kind of think about what we just heard. Okay. All right. So with the first question, which is the most relevant? There's different types of data and different types of data collection methods. We're seeing, sanitary risk data. Maybe people not using sanitary inspections as much in the room. Water quality seems more important, and water point breakdown. And then I think a lot of people are saying digital data is really important, which it is, and relevant. I still think that manual data collection, how to improve manual data collection is an important thing too. But so this is kind of a good feel. I'm going to go to the next. Let's see if I can get this over here. Let's go to the next question. This one's going to ask you to rank which of these things interest you the most, and that's going to help us understand how to direct these breakout groups. Okay. It kind of breaks my heart a bit to see that nobody cares about verification.
It's grown.
It's maybe a bad joke, but great. Well, okay. I am glad to see though that people we collect a lot of data. How are we using this data? How are we using this information? How is it leading to action? So that's something that we can talk about in the breakout group. All right, the last question, which I think is really going to help kind of you think about these breakout. Do you have any questions for presenters? I'm going to leave this up even as we kind of move around in the next bit. So if you have questions for specific presenters or for me, feel free to put them up here. And even as they come up in your discussion, you can add questions here, and we'll come back to this page at the end of the session. Okay. Okay. So with that, I'm going to invite us all to move into a time of breakout group or a World Cafe. So the way we're gonna divide this up is by data type. Okay. So for those of you who have experience or want to know more about sanitary inspection data, sanitary risk data, and you want to have a conversation about that, you're going to be joining Tess and Heidi. Where did I tell you guys to be? In this back corner back here. Also, I think I saw Bruce step in the room. So Bruce from WHO, I'd ask you to step over there too and help them out with the sanitary inspection conversation. If you're interested in water quality data, water quality information, Aaron and the Cova team is going to be leading that conversation here in the front corner. And if you're more interested in talking about operational data, especially breakdown data and user payment data, Ugandan Water Project is going to be leading that conversation in the back corner. This is very fluid. Don't feel bad. You're not going to hurt the presenter's feeling or the facilitator's feelings. If you're in a group and you just want to move in the middle of a conversation, that's completely allowed. This is a World Cafe. You can move around. I will somehow halfway kind of through our time, I'll call out, hey, if there's another group that you're interested in talking to, go ahead and move around to that. So I'll keep track of the time. And also, if you have specific questions for any of the presenters, you can just go to those groups and ask them when there's a chance. Okay. So we will come back together. I lost my time. Oh, Tanner stole it from me. I'll give you a 5-minute warning when it's time to kind of wrap up conversations and we'll come back. I think it's probably about 15 till quarter till, okay? All right, ready, break.
I grabbed it. I got back and I'm like, oh, took that.
What's that, Heidi? Okay, so this group is the water quality group. This group in the back corner is sanitary inspection group. And this group in that corner is breakdown and revenue data group.
I used to live in Florida and like semi-climate controlled and then I basically so maybe focus around where you're coming from, or we can jump in and start talking a little bit about your experiences, thoughts, experiences, questions in your. What is yours?
Okay, I'm Cameron Smith. I'm from the University of Ugandan School of Public Health. And I'm a PhD student, and most of my research focuses on water quality, but I also do things with like systems and like how like the associations of like waterborne illness or foodborne illness from septic systems or other kind of factors.
I'm Wes Meyer and I'm with Cova.
I'm Carly Steer. I'm also a PhD student. I'm in environmental engineering at Virginia Tech, and I'm also looking at private well water use patterns from like demographic patterns to water quality trends and like resulting outcomes.
Hi everyone, I'm Sheila Rangel, I'm the program officer. My name is Alyssa Rowley. I'm in water for South Sudan. We drill water wells, construct latrines, and teach hygiene education in South Sudan. So I'm on the communication side, but I'm just excited to be here.
And you want to introduce yourself?
Okay.
Hi, I'm Sylvia Landa. I'm a PhD student here at UNC Toronto. My PhD research is focusing to understand local government participation in performance-based financing to extend household access to cross-border in Indonesia. So I'm very excited to. And I work with governments quite a bit before I come here for PhD. So I'm looking forward to this.
Hi, my name is Ellen. I'm an engineering student at the University of British Columbia. I work with Clear Cambodia, which is a biosand filter.
Hi, my name is Ms. Mary Cameron, and I'm my institute, so we collect the policy data. Yeah, I work with it.
I registered from foundations, undergraduates, PhD students, professionals. So I think this is going to be a really interesting conversation. Where would you guys start? Would you like to start with any salient thoughts about maybe what water quality data collection means for you and your work? If you have questions for the group and the context and how this is used at a practical level. You want to share experiences of what this looks like, how you work in government? I can start. So one of the answers that previously like data use, Indonesia is one of the countries where we have rich data in my research. I think it's through research here with all of the data I can get.
And are you downloading the data? from
Recently, I got the data for eventually 37,000 water systems. In Indonesia, I was wondering, like, working with local government, village government, no one is really using this data. Like, people are collecting a lot of data. I heard even posted, we have national systems, but they're all integrated. Like different ministry have their own data. I have to go to different administrators and have to publishing it. So I'm really curious about like how actually this helps decision making. In my own research, the performance-based financing program that the government of Indonesia has implemented for a decade, it was tested through World Bank loan, USAID grants, housing grants. I read the previous reports, they're all quite good. But then once Indonesian government implementing it for almost a decade, my data is on 7 years, the district, we have 514 districts in Indonesia. Only 5% understand that continuously participating every year. It has been proven empirically this is more effective, more accountable from previous research. But my research found that actually politics is one of the highest reason why the mayor, if they're in the first term, facing re-election, more likely to participate, and also because this mechanism, local government needs to invest in their local water utility. Investment risk is the second highest risk. If the utility doesn't run well in terms of, in my variable, non-revenue water, then it's less likely for them to invest. So I'm really curious to learn if we want to advocate for more local government or government in general to adopt this really good system. What incentive and risk do they have that motivate or prevent them to take this approach and later on use the data?
So it sounds like there's a lot of data being collected. We're not sure if it's being collected locally, regionally, or what that looks like. But what you said, it sounds like, is that there is a gap between national and local management, and what does that look like, and how can decisions be made? And how do you know that that data is locally tangible, meaningful, or shared, or actionable? Yeah, those are lots of
Sorry, I talked pretty long.
No, it was very interesting. It was extremely interesting. I would love to know everybody's thoughts. Does anybody have a shared experience? Because that's
Yeah, we collect lots of data in that water. That's one of my questions I put up there is they're training on analyzing our data. It's not being used to show impact. We're collecting quality data as well.
I mean, there's
but it's not being
reporting bias, but anyway.
and used to. So we have it.
I love Andrew that he talked about the data dividend, and I also love like the data burden, right? And I know at data you don't know what to do with it, and it sometimes can be paralyzing or preventative for making decisions, and maybe leaving in an impression that maybe data isn't worth collecting for some reason, and that's not something that you're being able to get.
And the more data you have, the less trustworthy it is. So you have these simple things that you're collecting, it's a lot easier to ensure the quality of that. How does that apply for water quality? For instance, water quality is, how does Cova think about what parameters you're running, and then those have no idea. Some just use all the water quality parameters that you collect, and they all provide actionable information for you.
I do recognize that
I
would say yes and no. So yeah, first we follow a lot with the national standards. Like we're international, there's like twice a year requirements to test for a minimum microbiological, and then there's some other parameters physical. And at that point, that's kind of like government mandated. But then we're learning like now we're kind of looking back, so turbidity is something that we haven't collected as much, but we're really interested in, like, that's an important component if we're adding chlorination that I wish we had. So at times, there's like, we do collect extra data, we're very careful because every time we collect one more data point, it's taking either our technician's time or the PD's time, but there's also value to like, oh, if we would have, or for example, we started now tracking flow rates 3 years ago. We had the community track that we put into our database, they're measuring it, like that grab sample flow rate, and then we can start seeing trends. And that's where it's like, we haven't done much with it in the interim, but like we now have 3 years, like it's really good to start seeing some trends over time. So I think it's kind of like a give and take that we're really cautious about what we're adding, but like there is value to look back at the data and actually start, providing that. And I think the last thing that we're also trying to create better dashboards so like we have more reactive responses, especially to the water quality. But we can also go to a community and show them their water quality result for this quarter. But then also we're looking at, we flip over the other side and say over the last 2 years, this is what you're looking like. So you kind of see trends and they can learn from what they've been doing and how they're managing water.
And I think that's one of the interesting caveats of Cova as not being the direct operator of the system. We're providing support to the system. And so how that data is shared with the service provider directly, and then how they are sharing that with the local regulatory authorities, and how they use that to make their decisions, I think sometimes can be a little bit of a black box for everybody. And I think reactions happen at different time scales, from what I understand. And I think one of the nice things about providing the support, at least that the supervisors provide in Nicaragua and the Honduras context, even though we're not the direct operators, we're providing direct support that's actionable quickly. And so that kind of gets to your point of like, well, what happens at the local level? Is data being shared? And so, making consideration of how those mechanisms look and who those players could possibly be, it doesn't necessarily have to be this straight government scenario, right? Like there can be support systems in place, like local NGOs and other actors that can provide that service and bridge that gap, like you were saying. Does anybody else have a shared experience?
Maybe one more point on the data, data volume. That's something we've thought a lot about when we're trying to design this approach. What water quality information are we going to require? And it's pretty common. If you submit a water sample to a lab, you get a full panel of results. And most people, even water quality experts, often don't know what to do with all the information that you get.
Especially if it has footnotes and asterisks and the exceptions.
What we've tried to really think about is what is the most important piece. And I'm not saying that, all that information is valuable to some degree, but maybe an encouragement or a recommendation is just to really think through, okay, what are the top 3 or 4 parameters, and so when we require chemical samples require chemical samples frequently, every few years, but what are the top 1 or 2 hazards in this particular area? Is it arsenic, is it fluoride, is it water, and really just kind of focusing on that. And oftentimes we find that government I like an example of the Jal Shakti mission. If you go look at the Jal Jeevan mission website in India, they've got all these field test kit water quality data there. Millions of data points. And like, what is that information used for? It's just because they have so much. And so clearly recommending to try to stick to like the one thing, and even E. coli sampling, making sure you're targeting where you're doing E. coli sampling, and
They don't.
that information is going to lead you
I'm just wondering if asking that specifically, clearly you can get to that directly by realizing that, the thing's not out
I
there.
really like the idea on focusing on the highest list, because like oftentimes working with government, it's the saliency of the story. You said like we tested 100 things, it's kind of like difficult to focus your message, but like we have this arsenic in the water in here, their constituents that's going to be impacted, kind of like highlighted the highest trigger influence there.
Even if you get a 0 score, it's like,
Yes, I work with a completely local implementer And so we had some a lot of data being collected, but very few of them have any formal training in statistics or engineering, and thus don't know what to do with that. So I'm wondering if anyone else has experienced that.
So we're about halfway through the time. Not seeing a lot of people moving around, so I'm gonna give you an opportunity now. You're not gonna be rude if you want to change groups. We're halfway through the time. We've got about 10 minutes left in this element of the session.
I'm really curious to see how.
Can you repeat that?
Yeah, the question was, so.
Okay, yeah, so the staff that doesn't have any formal training, where they should go.
I think that is an awesome question, not that I want you to leave this room. By any means, I don't want you to leave, but if you were to leave, heading to the Global Water Center, I think it's an interesting space to give that to you, that question.
It's the same way I get to say it.
Please feel free to step away, just for that time, don't feel obligated to stay.
That is data. Because I'm more people about.
Yes, yeah, you can.
Right, come on. The preventative maintenance person came by on this day, and he did this.
I know, right?
So far, the room is, great. It's not asking, when was the last time?
Yeah, I feel like our conversation is maybe getting moving with a different question, or would you like to?
I have a question.
Yeah.
For Cova. So I know you were collecting all of this data, I assume, for a while, and then I know you were part of the Uptime water quality pilot. Were you already collecting everything that Uptime was asking for, or did you have to add new things?
No, and yes. So the water quality data, the water quality samples, we were collecting that at a much, much lower frequency. And really, communities would come to us to meet their minimum twice a year. But I would say only a fraction were actually meeting that the national requirement. With Uptime, that's where we were very intentional in communities saying, like, not only should you be doing it twice a year, but we're going to be doing it now quarterly in 2 different points. That's on like the water quality. So same data, but now higher frequency. We were not implementing sanitary inspections. I actually found it to be very unique. It was just one WHO, but again, the risk-based approach to really kind of like saying, and then also providing more of a scorecard for like, this is where you missed, but this is how you can improve it. There's a crack in the tank, there's some obvious things, there's some other things that may not be as obvious. So that's been, and even that, whatever the summary form that we can give is actually really good. So it's really improved, I would say, just our quality of service, but also our quality of data. And then also it's really nice about Uptime is that it's requiring to report back to the government and report to the community, and so like we were generally doing that, but it's just again really aligned us to do that.
Were you using water before working with Uptime? How long have you been using it?
Long time, it's probably like 2015 or something.
Oh, okay.
Or I mean, 2016, but quite some time. We started like using our own surveys, it's very simple. We had a consultant kind of help build out some stuff, and then so it's been integral.
Okay, so that's probably now transition to Uptime too.
I would, yes.
And Cova also collects data that is used by Uptime. For example, we mentioned the frequency residual measurements and how we use them to understand what the system operation function. We do focus on chlorination, and so managing that data and moving towards we're simultaneously, I guess we were talking about a little bit of the data burden and what do you do when you have too much data, what data you're using to make decisions. And I think, to that point, there were adjustments I think that have been made for Uptime, but there's more data being collected than what we need to.
Actually, I was going to ask you, because I was kind of in the other session, but is there an element in your partnering with Uptime which your motivation is to show up so that you get funds? Does that realign the motivations at all as far as the data that you're collecting? Like, they're not requiring preventive maintenance tracking because although that could lead to a downtime system, but you're probably interested in preventive maintenance. When was the last time
the monthly service.
All of that activity is documented in MLR. So every type of service visit, per se, or technical assistance visit, capacity building, all of those items.
So we do track that, but it is really important, the incentives that Uptime is identifying, fortunately, we really, that incentivizes very well aligned with our model, very, very well. And so that's a good thing, because and there are some things that, like in the water safety pilot, that are still harder for us, like reporting and testing, some like date requirements that if we miss it, then also we miss a payment. And so those we're trying to re-identify and align with, but it's results. So like they don't push for activities, like it's on us to figure out the activities and capacity building that we need to do, so that the communities do have high quality water. And then we're also just looking back and sure we're safe or not.
People are reporting quarterly with all this information, but what's actually going on? What is that look like? And that really gets to what you were just asking, because during the audits, this complementary data that isn't essential to the actual contractual calculations, for the incentives that you're receiving is asked for. It's like, hey, when did you visit them? Hey, they had a coli at this level on this date, it's down to 0 now, what did you actually do to make that?
Yeah, unfortunately, they give us like a sample of 30 communities, and we give them all of our data for those 30 communities. A lot, you know, every visit, every activity, every single date, timestamp, all that. So we can kind of say, look, this 30 has been going on here, even though we don't report the result, just because, and it's still, it's intense data that we have to report, and how we organize it, but again, aligned.
And for smaller subsets, so like Uptime, when we were talking about data burden and data dividend, and how do you keep things simple and practical, and Uptime really champions that approach.
I'm sorry.
Another question about that, like how do you say like the data of without being used, like how do you say when you say anything about that?
Can you repeat the question?
Sorry, okay, so you collected a lot of data, right? And then I'm curious to know how it's used. Do you have any sense of the data has?
I mean, so it really depends on who the data is for. And so first off, we're really doing a much better job of creating dashboards for our technicians to prioritize. So they support about 15 communities and have various activities and various trainings and results and visits. And so at a minimum, we're trying to get better feedback so that once they log out, because they visited, let's say, 40 of the 50 communities, it's clear that they need to go visit because every month we're doing a chlorine residual, or we've done trainings every 2 years. And so it's helping provide that feedback for the technician on what activities need to take place, as well as trying to get more information to the community so that they can react again on the water quality, on the chlorine residual. So it has helped. We are using that, but I think that's a big opportunity for us because we get a lot of data, we get it, sometimes we send it to Uptime or to other partners, but then other times it just sits. You know, like we need more, like, and water is amazing, but it's also because we're creating the dashboard, we're not, you know, like it's not perfect. It's not a perfect dashboard that we're creating, and it's not typically real time. We'd love to get there and like have more alerts on it, but you know, how much can we invest into it?
And currently though, I think actionable, tangible ways in which the data.
Okay, we've got about 2 more minutes, so just wrap up your conversations. If somebody's got an urgent question, 2-minute warning.
The increased contact and the requirement to, for example, a positive E. coli test, like having to do that quarterly instead of biannually, it provides a great opportunity to check in, and if it's positive, say, okay, what's going on? Like, do we have to look at the chlorinator? Do we have to look at adjusting the dose? How can we fix this? Sometimes the solution is really easy, same day. Sometimes the solution takes more of a detailed technical assessment. Sometimes it's beyond our capacity to help them fix, and they need more of a investment that corresponds to the document, right? So what does that look like every situation where it's different? But I think on behalf of Cova, the data is to try to just inform.
Less than a minute, but kind of E. coli test.
Yeah, it's all per in line with government regulations.
Under or
you have different labs.
we have various labs now, just to bring it closer, like a 6-hour coast. Because we're rural, Yes, both sources.
Yeah,
That's a very good answer, I'm very happy.
they make it complicated. They make it complicated there because they have a 6-hour sample to process.
Yeah, oh, is it 6?
6.
Okay.
It's not, yeah, or 8 hours, the whole chain of ice.
Yeah.
And, but yeah, no, 6 is tough when you work in rural communities.
But now we have enough frequency, enough numbers, you know, it makes sense in zero. In Nicaragua, where they still, the government still promotes H2S or like compost screen, so that can be field test, you know, in coordinated systems. Yeah, exactly, positive, but there's actually like how dark it gets. Is it really dark or light? You give at least someone maybe. But yeah.
Actually, turn dark, it's all 20 hours.
I know, right? What have you guys used in various?
It varies,
That room, when I was looking at the slide of it,
myself, like,
there was nothing to ask.
if I'm traveling,
When you technically you don't need to, you can do uptime, but I wonder.
The presumption is
it's, there's a certain hour, I remember.
Not college, or?
And the 3 ends.
Oh.
I know, but I was just thinking
About
about
those.
maybe having
I'll share some.
Yeah.
They're very unique.
you know, why not ask?
Yeah, to track
Something to know.
Even if everybody,
Obviously,
like the guys saying that don't do that.
We did those in our, like, environmental class, like.
What's that?
The problem is you're just.
I don't agree with that.
Milliliter instead of 100.
Okay, everybody, let's wrap up the conversations.
Oh, no,
Red and blue.
in 24 hours?
24
In
hours.
1 milliliter?
You do not need to reorganize your chairs, but I would ask
You don't have to.
maybe the facilitators, in order to facilitate this break, could the facilitators come up and join me?
Yeah, which is why usually I'll say.
I do, I'm gonna do the summary as I walk.
Or for.
Okay, so, yeah, you can just kind of turn your seat around and face this way wherever you are. I'd love to hear if there are any poignant thoughts or major questions or anything from the facilitators that didn't get answered.
We're working together. Yeah.
Any feedback from you?
Oh, from
Yeah, this is just from you. So I'm asking the facilitators of the groups if there's just sort of any common themes or thoughts that came out of that. And Heidi, if you need to collect your thoughts, you can maybe hand it to Aaron or to
Have you
to Tanner.
collected your thoughts? I'm happy to collect my thoughts. I'm gonna collect my thoughts after collecting yours.
Awesome. All right, I think from the water quality group, there were probably, I could say, 3 themes that were touched on and discussed a lot. One was the idea of having too much data, people not knowing what to do with it or how to make decisions with it, and too much data to share from the national level to local level to making decisions, and how do we go beyond that? How do we use data effectively? And I think that kind of circled around conversation around capacity building and what that looks like at different levels, be it at a national regulatory level or at an actual system operation level. And then there was also question in terms of roles and responsibilities, probably. Who's responsible? Who can help bridge that gap in terms of that data disparity, if you will, and having too much, but then not having it being used. And I think, did I miss anything? Water quality group? I think those were the 3 main ideas. Wonderful. Are you ready, Nikki?
Sure.
You collected.
You actually collected my thoughts while you're speaking. I was like, oh yeah, that's what we talked about too.
Awesome.
So-
I figured because there's a lot
Yeah,
of
there were
overlap.
synergies with that. So, and that's just what I was writing is one of the comments was baseline knowledge. And as a learning engineer, expert, that is typically where we start, is like, what's the baseline that you're having to start from? if you're trying to get over here and you think you're gonna start here and get here, but you're actually starting over here. Maybe I gotta flip that for you folks, because it's online. So if your baseline is here, and you're trying to get up here, and you start here, there's gonna be a gap. And so one of the stories that came through was just, they don't even know really what they're looking for. Like, what does a crack mean? Where is bacteria? Just even that concept. And so being able to implement these tools from a capacity, perspective is gonna be a bit of a challenge. I think the thing that came to mind to me while the stories that we're telling is just really the essence of, and I got this from working with Angela and Rory as well, is just start. And that's the progressive improvement part, is one of the comments in our group was like, you feel like you have the sense where you have to be an expert before you even start. And actually in this process, I would say, just start and learn as you're going, because it's going to be in the practice of actually doing it. That's going to build the capacity over time instead of waiting until we've just got all of the expertise. So being able to collect that. One of the key points that came, which I thought was great from Ryan, is like looking beyond the score, that it's not just the ticking the box and getting the score, but it's actually the process. And so again, starting at that progressive improvement, trying to collect the data the best that we can to build trust in that data takes time. And also during that time is when you're building those practices and incremental improvement. I had one other, but I can't remember. I'm going to hand it over. I'm not gonna. Thank you.
Yeah, I think one of the main things that came up in our session and discussion was talking about the different ways to collect and like kind of the resolution of breakdown data or preventive maintenance data. So, going from periodic spot checks at that level of resolution to, customer reported breakdowns to, sensor reported data where there's continual monitoring. So we're talking through some of the pros and cons of each of those different approaches, as well as, some of the limiting factors in different contexts that we work in. Sometimes you can't rely on a customer report because there's no cell service in the area, or you can't necessarily work with the sensors for similar reasons. So just talk through some of that continuum of data resolution. Also talk through just the idea that you manage what you measure. So if there's ways for local water authorities and the government level to collect preventive maintenance data, that drives action, or maybe there's pathways by which the service providers who are doing the service delivery in those different areas are able to seamlessly share that data with the government, and that's a stepping stone into the government having that visibility and be able to manage effectively.
Thanks, Dana. So I hope that was helpful. We've queued up a few folks to give just a few closing remarks, just kind of send us off after this session talking about data. In particular, what is the value of actionable data for governments and funders and governments as a funder? So I think first what I would like to do is invite Bruce Borden from WHO just to share his perspective. Yeah, you can stand here. And then we'll go to Engineer Ivan Burunji from MWE, and then we'll wrap up with Lewis. So I'll invite you up in a minute.
Okay. Well, thanks a lot, Andrew. I think the first thing that I love this session, and I think it's because we're dealing with something that isn't easy. Trying to collect and use data, like in rural settings that are poor, to actually drive corrective action meaningfully has been a problem for, as long as I think anyone can remember. And I think that too long, there's this issue of like, okay, is water safe or is it unsafe? And if it's safe, what does that mean? If it's unsafe, what do we do with it? Like, how do we make sense of this, as was just discussed? There's a lot of opportunities here, and that's what I'm seeing, that I'm excited about. And I think the obvious ones are like the sort of the technology, like the water quality tests themselves, or the digitization, or the mobile phones, or the sensors. All these things are lovely, but I personally have a soft spot. I was in the sanitary inspection group, but just this fundamental shift to getting people to think about, okay, we have a problem, what is there that we could do about it on a local, you know, like utility, or sorry, a local water, you know, in a rural setting. It could be something that putting a fence up, fixing like the crack. And then at a national level, it's like trying to use that data to like actually prioritize where the most vulnerable are, right? You could even use health data for that as well. But it's fundamentally about trying to, you know, prioritize with scarce resources. And I think that's what we're getting at today. And I think that was really one of the issues I think we had, you know, just with trying to align this with the WHO guidelines for drinking water quality, which you've done a superb job at all discussing together, because I think sometimes when the challenge is really great, people just, you know, they stop doing things, right? Like it's just, we've got E. coli all the time, you know, and that's just the way it is. And I think I think this really brings us the next step forward, right? And I think we're going to continue to see an ability, I mean, and I like this just start business, because I think people need to change their mindsets first. And again, this real emphasis that everyone's talked about using the data, right? Because we've all had experiences of data collection and sitting somewhere and no one makes sense of it, or it just is not interpreted well. So that I'm really pleased to see that connection. You know, these are areas that may not even get any regulation, and so I think regulators and oversight would be interested when there's an actionable way forward, when they can say, hey, you know what, this all makes sense. We have this, I can show someone. So, you know, congratulations. That's my perspective.
So next, I'm gonna give the microphone, hand it so you can. We have Assistant Commissioner Engineer Ivan Luigi from Uganda Ministry of Water and Environment. We'd love to hear his kind of thoughts, just a couple minutes on how government thinks about value data.
Thank you. Colleagues, I will start by first of all mentioning that as government, and I believe, I don't know if I'm the only one from government, as government, we expect to have accurate, timely, and reliable data. I come from this area of work where I only deal with data. This is what I do on a daily basis. And the data that I deal with is mainly from water supplies. And maybe to put a small context on why I'm mainly concerned with water supplies is because we are a country of about 50 million and 84% of the population is in the rural areas. And of this 84%, it's only 67% that has access to basic safe water coverage. So the problem that is at hand is really, really huge. I've listened in to, first of all, to my colleague here, Tana Hoffman, but also to several our other colleagues here from different partners, different funding organizations, different, in all your different capacities. And for me, as a person that works with government, I would wish to have all the different partners moving in the same direction. Why am I bringing this up at this point? I know Tana is looking at me, but the Ugandan water project came in to the water sector in Uganda and developed an information system called RUMIS, and he presented about it. RUMIS is built on the M-Water platform. The engine of RUMIS is M-Water with all its capabilities, world class. It can do lots and lots of things. It's been customized properly with our involvement, with our guidance, with our leadership as government. We have so many players in Uganda, so many partners, so many stakeholders. We have put in a lot of effort into this system, into developing this system. So we would like to see the different partners relay their data to government through this system. Otherwise, it is redundant. Otherwise, the effort and the funding that has come from all the different partners is not optimally utilized. So, RUMIS has more or less our aspirations as government. We would like to have common understanding of nomenclature that we use in the sector. All that is captured under RUMIS. Our key performance indicators that we are most interested in are captured under RUMIS. So all we ask of you and others who are not around is alignment towards RUMIS, towards the provisions that are captured, especially in our relationship defined by a memorandum of understanding with RUMIS. So RUMIS has helped us to come up with a system that is able to more or less deliver what I mentioned earlier: timely, accurate, and reliable data. It has helped us to do that, at least for all the 23 districts that have so far been covered. We still have a huge task ahead because we are a country of 146 districts. Okay, 145 minus the capital city is run in a different fashion. So we still have about 122 districts that are yet to be covered. We invite all of you to come and have this gigantic task that is ahead of us. I will mention this as I close. That I've seen the Ugandan Water Project come in, join us from just barely trying to understand the sector to where they are now. And I can mention this, that the only way a partner is going to succeed in navigating the complex structures of government is when government is involved from the very start of the operations in the country. We are involved, and we move together with the implementation of the activities until we scale to the national programs. That is the only way, and that is the way in which RUMIS has succeeded. Then the very last one is we do expect that if a partner comes in and they are doing an intervention, it is piloted, the results are, they speak by themselves, they are presented to government. I don't know how many times you guys have presented to government. They are presented to us. When I say we, I mean at the center and also the local governments. We all approve of the results and we all move together in the scaling of the results, of the interventions, of the program, such that it has maximum impact. This is all I can say. Thanks a lot for your attentiveness. Thanks a lot for your enthusiasm. Thanks a lot for what you do and for funding RUMIS and for funding the Ugandan.
Thank you. Thank you for contributing to our session, so we need to wrap up, but I would be remiss if I didn't at least give Louis a chance to give us a zinger.
1 minute.
Because, so Louis Borson with Osprey Foundation has been a partner with Uptime since our founding as well, and so we'd love to hear sort of his perspective on this topic.
So, this is embarrassing because government should always have the last word. And I think those remarks were really important. It is also nice to be in a room with a bunch of data nerds. So I think that's a good sign. Very quickly, so you can get your coffee. I'm going to provide a little bit of context here, which I think is consistent with what the engineer said. The discussion today, from my perspective, is as what I would call a third level. Very quickly get to the third level. The first level is starting with what the definition of success is in this sector. And from Osprey's perspective, and hopefully a few other people's perspective, the definition of success is not installing a piece of hardware. The definition of success is getting communities that need it safe, affordable, sustainable, and scalable services. And that is services that need to keep going forever. So that's the first level, the top. Results-based funding of the sort that Uptime and others here work with offers a path to delivering those types of services, but only if you can meet certain criteria. The criteria I usually talk about are the right set of performance metrics, and I would say that the 4 metrics that Uptime uses are pretty darn good. And then competent service providers who can actually meet those metrics. But in this case, we're actually down one level from that, which is if you want to get to replicable and scalable services, you have to have high integrity, low cost data. There's no way to scale up if you don't have that. Because that means you can get data that is valid and is there in the most cost efficient way. So I'm thrilled that we're here today down at this third level having conversations that are in service of getting to the second level, results-based funding that is serving communities with sustainable, safe, scalable, and affordable water. And I think it's helpful, we're a little down in the weeds, to step back and say, we're actually all going at the same place. So, that's it. Thank you for your time and for giving me the chance to say something.
Thanks, Louis. Come find me on the hallway. We've got to vacate the room. So here's websites if you want to take photos of the slides. Thanks everyone for participating.